Hello there, my name is Jack Dove.
My name's Jonathan D'Souza.
My name is Aisha Asdal.
And I'm John.
And together we are team number 3 for Design Project 4. Today I would like to share our presentation on improving the control of medicines in perioperative care. So for this assignment, we were working alongside client number 1, and we were assigned to the Hamilton Health Sciences Heart Investigation Unit, or the HIU.
So first, I'll be talking about our approach to addressing the needs of client 1. Our needs statement addresses that medical professionals need to have an integrated software and hardware system that tracks, checks, and disposes meds to avoid medical errors. It's important because medication errors can cause life-threatening situations and increase expenditures. Our client is Hamilton Health Sciences HIU, which is responsible for diagnosing and treating heart conditions. Currently, there are 3 issues in perioperative care. One is system issues, which include checklists and communications. Another one is monitoring issues, which includes enforcing the existing standards. And there are also issues of clinical care that includes medication errors in the OR. So we're looking for implementation of Omnicell automated dispensing cabinets. They can document the use of medications and especially control medications by scanning the barcode. Currently, Texas Children's Hospitals is one of many top-tier hospitals that has this cabinet, and they work properly. We're also looking for combining Epic system to the cabinet. It is a patient-centered system, and patients have their personal health information. However, it usually takes a long time for the hospitals to change the workflow. Factors that slows down the implementation includes medical professionals' limited experience with the new devices, the startup cost of system, and the new software itself.
Now I would like to talk about the current state of our proposed solution. But before that, I would like to mention the current medical documentation system in Hamilton Health Sciences. So the current medical documentation is not accurate enough to provide an idealized way of receiving, disposing, and safely storing narcotics. The documentation is made with pen and paper, and almost no software is used to verify the collected data. And when used, software involved is oversimplified and only includes checkboxes and filling out forms. And these forms only keep track of the inventory and do not contain any information about restocking and wasting medicines, which often leads to medical errors. So, Hamilton Health Sciences concluded that it is necessary to have a technology-based system to ensure the safety of the narcotics and to reduce the risk of the existing control systems. For this transition, Hamilton Health Sciences purchased automated cabinets that are expected to come during the second half of 2021. However, this new technology is different than the current system, and its implementation will require some time to complete the learning curve. To smooth this transition, we met weekly with the project lead to learn more about how to adopt their current system to this new technology and provided a future state process map. The specific changes we made include assigning more tasks to the scrub nurse, assigning duties with ambiguity to specific medical workers, and adapting their current state documentation process to fit the new technology.
All right, so now I'd just like to discuss some of the challenges and failures that we ran into when going through this project. And the main one of these is that our first meeting was actually canceled by the Heart Investigation Unit due to a special scheduling of surgeries, I suppose. And this caused us at the end of the project to be unable to discuss our pre-mortem exercise with the Heart Investigation Unit. And to prevent this from happening in the future, there's nothing really that we can do, as they're very busy doctors, but perhaps having a makeup meeting within that first week would have been possible. And then another problem that we ran into was involved with the software of Visio. And what this happened here is that we were given a process map on Visio, but we didn't actually have access to the software, so we had to copy and paste that initial process map over into a different software and then work from there. And in the future, to prevent this, we could just purchase Visio itself, and then it would save us a lot of time from doing that step.
You've seen the challenges we've had to overcome, but this is not the end of the story. What we have provided is a future state process map tailored to the HIU, but there's still many more challenges ahead. This is why the first and foremost step is conducting a pre-mortem exercise with the HRU team. This involves generating as many problems as possible that can be thought of before the final implementation and usage of the system. Unfortunately, due to the circumstance, we were not able to participate in this. But we did brainstorm a list as part of our project requirements. We grouped errors into 3 different categories: human, mechanical, and workflow to help organize the exercise better. Through this pre-mortem exercise, we hope that our process map can be expanded to include more specific time intervals and medication requirements. We also hope there is thorough practice done with the test card before the July to December implementation. Real-life simulation has no better replacement, and we feel that it is key to identifying gaps in our proposed map. It will also help reassure the HRU team that the system will be successful. Finally, once the Omnicell system is in place, it should be combined with EPIC, an electronic medical record system. This will work with the Omnicell system to further streamline the flow of medication dispensing to patients. This concludes our presentation, and thank you all for listening.